Hi, Derek Sprout here again. I just wanted to give you a 6-month final wrap-up on my whole spinal fusion surgery, and to say that it's all resolved itself, and I consider myself about 95% healed, and certainly way ahead of where I was pre-surgery. So that final 5% is just a little bit of conditioning left to do, a little bit of the odd little ache and pain in my lower back from the fusion area, but I'm just doing so well. It's just fantastic. I'm on a bit of a high. So just want to give you a little bit of a recap. So last time I talked to you, it was still fairly early on. I had been hoping to get on my bike after 3 months post-surgery, and I did. I was actually spinning indoors at 2 months. And then I actually did my first bike race, my first 90-kilometer, fairly hilly bike race, just under 3 months. And my surgeon had said that it was okay to get back on the bike because my fusion was taking well. And I was definitely sore after the bike race, and the spinning beforehand was a bit challenging for me as well. Just like physiotherapy, doing lots of physio over that 3-month period, and or I should say from about the 10-week period up to the present day I've been doing physio, and often physio would make you sore, make me grouchy afterwards, but it's a little bit of a no pain no gain situation. So anyway, I did the bike race, definitely was feeling it after the race a little bit, but wasn't terrible, and got on with my day, got on with my life. I did another race just a couple days ago, the 5.5-month point. Much bigger race, 122 kilometers, a little under 7,000 feet of vertical, the Vancouver Whistler Fondo, on September the 8th, and it was, no problem at all. I mean, I felt tired in the last 20K just because, I didn't get a lot of training in this year. I was in Italy with my family in August and didn't get more than about 1.5 months of training in this year. So without the miles, without all the training, a big race like that, it's pretty tough to do. But the really interesting thing is I didn't end up with any soreness, certainly nothing to complain about. And this brings up the whole point of what you don't realize before the surgery is the huge improvement that you can typically make when the nerves that haven't been functioning well for years because of the spinal degradation, how those nerves, when they start to fire properly, I end up with more symmetry in my body, better sort of side to side sort of balance in my strength. My core strength is better than it's been in 20 years. And so I feel more stable on the bike, I feel more stable walking around. I'm straighter, my neck and my back don't have a bit of a curve anymore. And so it's interesting, during the recovery period I used to, like for instance before surgery I was always stiff on my left hand side. My glutes, my hams would often be really, really stiff, especially after any type of gardening work, any type of exercise that would involve my legs. It would stiffen up and I'd really have to stretch. And during the recovery period it sort of shifted away from the left side to the right side, where it's sort of like my body's kind of figuring this out, and all that sort of asymmetrical stiffness seems to have dissipated. And the other thing I should point out, by the way, during that period of about 3 months to 5 months, I was getting some SI joint pain, some sacroiliac joint pain. So my sacrum is now fused to my 2 lower vertebrae. So it doesn't just movement and forces in the body transfer to the first motion segments on either side. So the first motion segment on the above is L4-L5, so I have to be careful not to overwork that segment right now or any time in the future. Specifically golf, the advice I've been given is go ahead, you can golf, but make sure it's a half swing, make sure it's not full power, don't use your driver. Just take it easy on that spinal twist from now on, because you don't want to start wearing out the unfused segments that are adjacent. And then below that, your sacrum is not fused to your pelvis. It's actually got these movable joints, these SI joints, and those joints can take a little of additional punishment. And there is some statistics out there that say that people with lumbar fusion will end up experiencing SI joint problems. But it all went away from me. So I bought this memory foam topper on my mattress. I have a fairly firm Sealy mattress, and I put this memory foam 2-inch topper from Costco onto it, and it sort of helped it all settle down. I've gotten rid of that topper for now, and to see if it ever comes back, but I think it was just part of my recovery process to get a little bit of that pain. So I'm good. It's the last time I'm going to post a video. I wish everybody else the best of luck if they're considering this. I was one of these guys that had a case that, you know, the surgeons were like, not sure, because I didn't have really strong sciatica that says, bingo, this is the pain generator, let's go and do this surgery. I had more discogenic, more diffuse pain, but now that I'm better, I realize it had become quite severe. It had probably given me low-level depression. It had certainly made me grumpy from time to time. The instability would cause me to have my back go out and lose my leg strength and not be able to walk for days, be in bed for days. And it was like a Russian roulette mode. My back would pop out doing the simplest things. And now I've got this huge confidence. I mean, in Europe, I was taking 50-pound luggage, you know, bags and cases of wine and you name it, and I was tossing it around. And I mean, I was sitting in coach for 14 hours coming back from Rome to Vancouver, and it didn't kill me, and that would have definitely done me in the past. So I'm hugely thankful to my surgeon and thankful to my family and friends and everyone that supported me during this process. And I'm just happy to say that I get to turn 51 years old in a couple of weeks and be in the best health that I've had in many years. So thank you.